I'm the Region 2 Area Agency on Aging Elder Abuse Victim Specialist Program Manager, Angie Shepard. Hi, Angie.
Hi, how are you?
Good. How you doing?
Pretty good.
Yeah, welcome to the show.
Glad to be back.
We wanted to get together this month because March is National Social Work Month, and your agency depends heavily on social workers.
We do. We actually have a total of 20 social workers with our agency, including myself. 20 amazing social workers, I can honestly say. So it's a big celebration for us at Region 2.
Yeah, and today is actual National Social Worker Day, so we salute you and thank you for the work.
Well, thank you.
And you know, kids when they choose to go into social work or choose to go into to get an education for that, everyone always thinks, "Oh my gosh, you know, why would you do that? You're not gonna have the income potential. You're gonna be, you know, limited." But it is. You do sacrifice in order to do this work.
You do a little bit. I will say that I think as far as income is concerned, it's getting better, and we try to advocate in our profession for that because we have to have a minimum of a 4-year degree to practice social work in the state of Michigan. Mm-hmm. Many social workers have master's degrees, and you do sacrifice, but I will say that the rewards make it worth the while. Seeing the resiliency of human beings and how they can turn their lives around with a little bit of help is really great to see.
Yeah, it sounds like it can be very rewarding.
Absolutely.
And you're right. It's a profession. People have to get training. They, as you said, 4-year degree. Can you define what falls into social work?
Social work is defined as a profession where you advocate and assist vulnerable populations with moving through challenges and barriers to meet goals, basically. So you find social workers in so many different places. We work in schools, we work in hospitals and nursing homes, and in private practice and community organizations, the legal system, adoption, foster care. We do all sorts of different things. And really the goal is always really just to help somebody get from point A to point B and break through those challenges and barriers of whatever it is that's stopping them from getting there.
All social work, it's helping people.
Basically, yep. It's and the profession does require. I mean, you have to know a lot about systems and the economy and human behavior, psychology. Lots of science involved in studying social work. So you have to have knowledge, but then experience helps as well.
And the whole last 2 years, when we were hearing about issues the police were having to deal with. Some communities are saying, you know, we really should have people with, you know, social work skills and training and accreditation helping our police because that's missing in a lot of areas.
I agree with that. I think that police officers, we need them to do their jobs and keep us safe, but they don't always have the time to get in-depth training on behavioral health or mental health and that sort of thing. And I really think that that's where social workers could really come, you know, could help the situation. And
there's a lot of credentials, accreditations, licenses, tests. I mean, you have to go in certain areas. You have to go through a lot in order to be a social worker.
You do, yes. In the state of Michigan, in order to be a licensed social worker, you have to have a degree from a accredited university. Mm-hmm. You then have 2 years of supervision underneath a master's level social worker who is fully licensed, and you also have to pass a licensure exam. So it's a lot of work and experience and time that you put into to getting that certification.
The challenges, I think, in every profession, shortages of staff. How about in social work?
I would say I can't really say for sure if there's a shortage of social workers, but we see the effects of shortages in other, like right now with Region 2, there's a caregiver shortage, and that's a huge thing. You know, we need caregivers to go into homes to take care of older adults who can't necessarily do things for themselves, and with that shortage, it's been a real challenge for us to make sure that our older adults are taken care of in their homes. So if you're looking for a job, we need caregivers badly.
As the baby boomers age, it's going to get worse.
It is. We have more and more older adults that are going to be needing that assistance. So, and we do advocate for, higher pay and benefits and things like that for those. We advocate for other professions as well, because we know that we need those. We need those workers to support vulnerable populations. So,
Region 2, you've got a couple of dozen social workers. What areas are these social workers in? What are their job titles? What are they all doing?
They do several different things. Many of them are what are called supports coordinators, and they help the older adults in our programs stay in their homes. They coordinate services for them so that they can be successful at staying independent and safe in their homes. We have several social workers who are in management, who oversee the programs, and doing starting out in intake and referral, coordinating resources, all of that sort of stuff.
You couldn't exist without them.
We really couldn't. Our My Choice Waiver program, our contract with the state says that we have to have licensed social workers performing those duties. So we definitely need them.
Well, in your role as elder abuse victims specialist program manager during this pandemic, there are a lot of concerns that people were isolated and instances of abuse weren't being discovered and reported. What's the state of that right now?
Well, thankfully, we social workers and adult protective services, and we are able to go back into homes, and that really was the hard part, because we rely on sending social workers into the homes so that they can see what's going on, so that they can note any concerns, put interventions in place to help remedy those concerns. So thankfully, now that we're able to gradually starting to go back out in the homes, I think that that's going to start getting better. But that was, I think, probably every social worker I know at the beginning of the pandemic just kind of, started thinking about all of the different things that are going to happen to people, being isolated and in their homes. And it was a scary thought. I know it frightened me. So I think we really probably aren't even seeing the ramifications of that fully yet.
And they might be years to I guess, unravel.
It could be.
So many instances of abuse are unknown to a lot of family members, and they can even include neglect. They can include people taking financial advantage of seniors. Right now, what kinds of scams are you alerting people to?
Oh goodness, scams are just everywhere. I would say the biggest thing that we hear probably the most are the romance scams, where people reach out to older adults and form these love interest relationships with them, get them to send thousands and thousands of dollars overseas or wherever they're at, and then that person's just out of money. We see that quite a bit, and it's scary, and we're always trying to educate, trying to let people know that if something like that's happening, just talk, call us and talk to us about it, because we can help you through that kind of thing.
And for someone to do that, I mean, it's just despicable, but that means they're willing to invest months or even years in order to get someone's money.
It's true. It's
amazing.
It's hard to hear those stories. It really is.
And there's probably people that have been victimized that maybe they don't know it, or they're too embarrassed to tell anyone.
I think that I can't remember the statistic off the top of my head, but there's the majority of abuse and neglect cases with older adults go unreported because of that. Either they don't know that they're being abused, neglected, or exploited, or they're ashamed to tell somebody and ask for help. So,
are there signs people can look for? Maybe you've got elderly parents.
Sure. I mean, there's obvious physical signs, if you're seeing bruises or cuts or scrapes or anything like that just doesn't look right to you. But there's emotional signs, people who are withdrawing, who are isolating, maybe when they didn't do that sort of things before. Maybe they're bills are not getting paid like they should be, and you know that they have the income to pay them, that could be a sign that somebody's taking advantage of them financially. So lots of different things to look for. But I always say just, having relationships with the older adults in your life is one of the most important things, because that helps you familiarize yourself with them and their routines, and will help you identify differences.
Yeah, especially your neighbors. You've got neighbors that are older. It's up to us. Keep an eye on them.
Sure is. Yep.
Now, I know your hands are full, but you're always open to welcoming new clients and helping seniors in Region 2. If someone's interested in your services, how do they get a hold of you?
All you have to do is call our office at 517-592-1974. We have an amazing intake and referral team that will get you, talk to you and point you in the right direction.
Nice. And you're located, your office is in downtown Brooklyn.
We're in downtown Brooklyn, but we service Jackson and also Hillsdale and Lenawee counties. So anybody who lives in those service areas, call us. We'll see what we can do for you.
Nice. Well, thanks for being a social worker.
Well, thank you. I'm happy to be one.
And thanks to all social workers on this National Social Workers Day during National Social Work Month. Angie, good to see you.
Good to see you. Thank you.
Angie Shepard is the program manager for elder abuse victims at Region 2 Area Agency on Aging.